name is Joyce. I'm a guest, and today I'll be performing NG insertion. So the first thing that we're going to do is verify our medical order. Then we're going to review our medical history in case of nasal surgery or a deviated septum. We'll then gather our required equipment. We're going to get a graduated cylinder, a syringe, NG tube, lube, pH test strip, a cup with water and a straw, gloves, and suction if the medical order orders it. We will then perform hand hygiene. We'll identify our patient. Hi, my name is Joyce. Can you tell me your name and your date of birth? Alrighty then. We'll then provide for privacy. We'll assess mental status. Then we are going to explain the procedure to the patient. So today we're going to be inserting a tube through your nose into your stomach. And when it hits the back of your throat, we're going to establish a stop signal so that I can ask you to put your head forward when it hits the back of your throat. We're then going to assess the abdomen for any distension, pain. We're going to listen for bowel sounds, assess the nares for patency and breakdown. Then we're going to position the patient into high Fowlers, drape the chest with a bath towel or a disposable pad. Then we're going to don our gloves. Next, we're going to grab our tube, and we're going to take the tip, and we're going to measure from the tip of the nose to the tip of the earlobe, down to the start of the xiphoid process. We're going to mark our length, and then we're going to lube the tip of the tube 2 to 4 inches. We're going to instruct our patient to flex their head back against the pillows, and then we're going to insert the tube into the pharynx. Once it hits the back of the throat, I'll instruct the patient to flex their head forward to the chest. And then I'm going to ask them to swallow or take a sip of water as I advance the tube. All right, can you swallow for me? All right, swallow, swallow. And once it's in the stomach, we're going to secure the tube to the nose. Then we're going to check for placement. We'll attach our syringe and aspirate some contents. We'll look at the characteristics of the aspirate. If normal, it should be a green or brown. If it is dark brown with a coffee-like appearance, that'll mean blood. We're going to check our pH. And if it's in the stomach, it'll be a 0 through 4.0. If it's in the lungs or intestines, it'll be a 6.0 or higher. And then we're going to obtain an x-ray to check for placement. Once placement is checked, we will then mark the end of the exit with an indelible marker, and then we will measure the length of the exposed tube. We'll remove our syringe and either clamp the tube or attach to suction. We're going to secure our tube to our gown. Then we're going to place the patient in a position of comfort, and we will provide for oral hygiene. We will remove our gloves and perform hand hygiene, and then document the procedure.